So continuing our previous year NEET PG question series of 2025. This is the final question. I have compiled 2 or 3 questions into one question. I would have discussed 2 or 3 questions in one discussion itself. So with this we'll finish our 2025, and from the next video onwards we'll continue with 2024 questions. Okay, so it's a small question, we'll read from the front. A patient came with fever, headache and neck rigidity. Lumbar puncture shows gram-negative diplococci in gram stain. Which of the following will be used in chemoprophylaxis of close contacts of a patient with meningococcal meningitis? You need not break your head with the first part because the second question is straightforward. What is the drug used for chemoprophylaxis of patients with close contact with meningococcal meningitis? So meningococcal meningitis, what is gram-negative diplococci? Cocci is round bacteria. Diplococci is two coccus together. We have 2 gram-negative diplococci. One is Neisseria gonorrhea, which causes gonorrheal venereal disease, and another one is Neisseria meningitis. So Neisseria gonorrhea is shortly called gonococcus. Neisseria meningitis is called meningococcus. Meningococcus is one important cause of meningitis. It is an important cause of meningitis for your questions because it can be picked up from clinical clues. So I'll tell the few words associated with meningococci. So one is gram-negative diplococci, gram-negative cocci diagnosed in gram stain of the CSF. That is how you diagnose. In microbiology, you would have discussed specific culture medium like chocolate agar. Okay. Then it is one dangerous disease which causes adrenal insufficiency or Waterhouse-Friderichsen syndrome. It is one meningitis which causes skin rashes. So like they can give a clinical clue. Patient comes with neck stiffness, altered sensorium, there is extensive skin rash, patient has hypotension. Remember adrenal insufficiency, Waterhouse-Friderichsen syndrome. So when such clinical clues are there, we can easily diagnose it as meningococcus. So how will you treat? How will you prevent? Treatment is ceftriaxone. Ceftriaxone 2 grams. It is high dose ceftriaxone. Other drugs also can be used like ampicillin, etc. can be used, but remember one drug which is ceftriaxone. How will you prevent? Because we have to prevent a particular person from getting it, and we have to prevent contacts from getting it because it is a highly contagious disease. Prevention is always by vaccine. We have meningococcal vaccine. If time permits, in the last minute you can just read about the vaccine strains. We have meningococcal vaccine. This is a favorite question. How will you prevent contacts? It's by rifampicin. Of course, ciprofloxacin also is a drug which can be used, but rifampicin. Ciprofloxacin is a antibiotic with predominant coverage of gram-negative organisms. That's why it can cover meningococcus, but ciprofloxacin cannot be given in children because it causes cartilage toxicity. Similarly, it cannot be given in pregnancy. So rifampicin is preferred. In this question, I think there is no confusion because rifampicin is the only option which is there. Amoxicillin is not used in meningitis at all. Doxycycline has a role in meningitis, but it doesn't have a role in meningococcal meningitis. Ethambutol is a drug for tuberculosis. So rifampicin is obviously there. So treating meningococcal meningitis is ceftriaxone. Preventing meningococcal meningitis is rifampicin, ciprofloxacin. If at all these 2 drugs cannot be used, we can rarely use ceftriaxone IM in few cases, like single dose ceftriaxone. Okay, rifampicin, ciprofloxacin and ceftriaxone. Since we started meningitis, what are the other questions which can come from this topic? Since video based questions are common, we can get videos on Brudzinski sign, or there can be video of a person examining neck stiffness. Okay, like those videos can be given and questions on meningitis can be framed. So please do see some videos on neck stiffness. And in our previous question, like on ankylosing spondylitis, we may get some videos on Schober's sign. Like Schober's test is one clinical test. Schober's test is a test where we ask the patient to bend and we measure the distance from the posterior superior iliac spine, just for a measurement sake. So like videos examining the Schober's test may be given and they may ask question which disease is diagnosed by this test. It is ankylosing spondylitis. If time permits, you just see videos on this. And one more place where questions on meningitis can come is, they may give you a report of lumbar puncture and they may ask you what organism may be there. If a lumbar puncture is given, our aim is to differentiate whether it is a bacterial meningitis, viral meningoencephalitis, or if it is a fungal or tubercular. I think we'll keep tubercular, then fungal. Remember, in always bacteria, neutrophil will be excess. Cells will be high, but neutrophilic predominance is the important finding. Virus and TB, always lymphocytes are high. Virus and TB, always lymphocytes are high. Fungus, again, it's like bacteria, so there will be neutrophils. So I think we can write it in a different color. Fungus and bacteria will have neutrophils. Viral and tubercular will have lymphocytes. Then how will you differentiate viral and tubercular? We have the glucose. When cells are very high, or when organisms, live organisms are there, it will consume more of glucose. So tuberculous bacteria are live organisms, so glucose will be low in TB, whereas glucose will be normal in viral. So there is a lymphocyte predominant CSF with low glucose. With low glucose it is tubercular, with normal glucose it is viral. Usually they will be giving the reference range. What is the normal CSF glucose? If it is not given, remember, blood glucose level, patient's blood glucose level divided by 2 is the normal glucose of CSF. If the patient's blood glucose is 180 milligram per deciliter at the time of doing lumbar puncture, at that time the CSF has to be 90. 50 to 60%, 90 to 100, maybe you can keep as the range. If it is less than 50%, then it is low CSF glucose. Again, bacterial also, glucose will be low. Fungus also, it will be low. Then proteins. Proteins will be very high in bacterial, whereas it will be low in viral. Again, since TB bacteria is high, it will be high in tubercular. It will be moderately high in fungus. And they may give a few specific clues on organisms, like we have discussed just now. In bacterial, in meningococcus, there will be gram-negative cocci which can be seen in gram stain. In tubercular, they may give the word cobweb formation. In few fungus, they may give the clue of cryptococcus. Cryptococcus is a fungus, remember. They'll give the word India ink stain. So maybe these clues can help you. So bacteria is neutrophilic, fungus is neutrophilic. Viral and tubercular are lymphocytic. Glucose is normal with viral, it is low with bacterial and tubercular. Proteins are high with bacteria and tubercular, it is low with viral. And based on the specific clues, maybe you can pick. Sometimes if it is viral meningoencephalitis, they may give MRA as the clue. The temporal lobe is commonly involved in herpes simplex meningoencephalitis. That is why herpes simplex meningoencephalitis will cause behavioral disturbances because temporal lobe is involved. Another virus, Japanese encephalitis, this affects the basal ganglia. At least remember these two. Okay. So we just started with discussing one question. We have discussed the associated questions as a rapid revision. So this finishes our 2025 NEET PG question, previous year question discussion. From next video, we will discuss 2024 previous year NEET PG questions.